Our next speaker is Dr. Mary Westby. She's worked as a physical therapist at the Mary Pack Center in Vancouver for more than 20 years. She's currently CIHR-funded postdoctoral fellow in the School of Public Health at University of Alberta, as well as a trainee with the Arthritis Research Centre of Canada here in Vancouver. Please welcome Dr. Mary Westby.
Okay, what don't I push? The laser pointer is the yellow button, the bright yellow button. Okay, good. Thank you very much. It's a pleasure to be able to talk to you today about, we've looked at the spectrum now of arthritis, a little bit about prevention very early on, how important it is to stay physically active. Dr. Hunt just covered if you have moderate to more severe arthritis, maybe you're awaiting a joint replacement. So now I'm going to talk a little bit about why is it important to stay physically active after you've had a joint replacement. I'm going to talk a little bit about the current physical activity guidelines that are published in Canada, internationally, and why those apply to you too, even if you have arthritis or a joint replacement, and talk to you a little bit about a current study that I'm involved in. So in Canada, there's more than 80,000 total hip and total knee replacements performed every year, and that number has increased by over 100% in the last decade. And the reason that the number is going up is because the population is aging and the population is getting heavier, and those are two very strong factors to drive osteoarthritis. Everyone's looking around going, not me. But we also know it's a very successful surgery. Some people say hip replacement is the surgery of the century. But it's not without possible risks and benefits, and I'm just going to look at those and then go back, okay? So like any major orthopedic surgery, there are risks inherent in it. There is problems with complications or risks within the hospital, and there's some problems that can occur afterwards. But they're really, in this day and age and those techniques that are available, the risks are actually very, very low. There's also significant benefits. Lots of research has showed improved quality of life, reductions in pain, better strength and day-to-day function, better ability to return to meaningful activities, walk longer distances, etc. So what happens in a hip and knee replacement? Yellow button. Okay, good. So in a hip replacement, I'll just talk generally and briefly here. Basically, the end of the bone is, oops, I just touched the yellow button. The end of the bone is either sort of reshaped or cut off, and a metal implant is inserted down the stem of the femur. In the case of the knee replacement, it's capped on either end of the bone, on the femur or the thigh bone and the tibia or your shin bone. On the pelvis side, that ball that we normally have there that articulates or moves the hip. I don't have a degree in IT either. Is sort of shaved out and a plastic liner is put in. So a metal ball now articulates or flexes back and forth with a plastic cup. And that's the gold standard in hip replacement. There's lots of different types of materials used and different types of prostheses, they call them, but that still is the gold standard and has excellent 15 to 20 year success rates in most cases. With the knee replacement, that metal tray is capped with a big thick polyethylene or high density plastic, and that metal sits on top of that plastic tray and bends back and forth. They keep the ligaments on either side of your knee, your collateral ligaments, and sometimes they try to retain or keep your posterior cruciate ligament, one of those X ligaments that's inside your knee. Okay, so the surgery is very successful. It's a godsend for some people who have that end-stage pain that's keeping you awake at night, that's preventing you from being active. It's your biggest barrier to being physically active, like the way the previous presenters have suggested it's important to be. So what are the benefits then of being physically active? Exercise is a subset of physical activity. It's usually a more planned type of movement versus even doing housework, unfortunately, is considered physical activity. But just moving about in your community and leisure activities, whether it's bowling or gardening or housework or walking your dog, that's all physical activity. And then exercise is considered sort of a structured aspect of that. So we know that the benefits of physical activity include better fitness, better ability to be mobile or be up and walking around. It's good for your muscles, it's good for your bones. You have less risk of falling. People with any type of lower limb arthritis, whether it's your ankle, your knee, or hip, are at a considerably greater risk of falling. Okay, so and if you were to fall, if you're someone who's more physically active and has stronger muscles and better bone, you're less likely to break something. There's also a much decreased risk for some of the other health problems like cardiovascular disease and type 2 diabetes, a lot of conditions that are associated with being physically inactive. You sleep better, you have more energy, you have a better mood, and it's associated with longer life, being physically active. And we all want that. Okay, but how active are people after joint replacement? There's been a number of studies that have looked at people anywhere from 6 months to 5 years out after they've had a joint replacement to see, are they returning to being physically active? And the answer is unfortunately not as much as we'd like to see. So when they match people who have had a hip or knee replacement to those people who are the same age group who don't have arthritis and haven't had a joint replacement, they're definitely less active than those healthy peers. There's fewer of them are participating in sports, and there are fewer sports that they tend to go back to. When they've put pedometers or accelerometers and had people wear those for a week after and compared those again to their healthy peer or age group, they found that those people on average take much fewer steps than the peers, and all of them were taking much fewer steps than what is recommended. What they did find in some of that research is that if you had your hip replaced, you tended to be more active than if you have your knee replaced. And that the most common physical activities that people were returning to were walking, golf here in North America, swimming and other aquatic exercises, bicycling, whether that's outdoor bicycling or on a stationary bicycle, gardening and yard work up until this week when the rain started, and weight or resistance training. So those are the type of activities that people were returning to. And they tended to be lower intensity activities than what they might have been doing prior to surgery. So what are the guidelines? Is everyone familiar with the guidelines that are put out through Participation and through the Canadian Society of Exercise Physiology? You see it in the news. It's sometimes even on TV and radio stations. Are people familiar with these? Hands up if you've actually heard of them. Doesn't mean I'm asking you if you do them, but you've heard of them. Okay, so the message is getting out. But unfortunately, the message is getting out, but it's not sinking in. So as Dr. Lee has mentioned, we are being recommended, every adult is being recommended to accumulate about 150 minutes. So that's, say, 5 bouts or 5 times a week, 30 minutes of moderate intensity exercise where you're just a little bit short of breath but can keep talking each week. And it's okay to accumulate that activity in 10-minute bouts. So even if you go for a 10-minute walk in the morning, and then in the afternoon maybe you do a 15-minute walk and you add all those up, they should add up to 150 minutes during the week. That's the recommendation. Strengthening exercises, also called weight training or resistance exercises, should be done 2 to 3 times a week. You'll make better strength gains if you exercise or do these exercises 3 times a week, but you can maintain and make small gains if you do them twice a week. So we tend to, in physiotherapy, tell you to do them 5 times a week and hope you'll do them 3, in all honesty. Flexibility exercises to stretch or keep your muscles flexible, let it crossing the joints, especially if they've gotten tightened, shortened while you're waiting a hip replacement. A common flexion problem at the hip is that your hip won't fully straighten anymore. You have what we call a fixed flexion deformity, and so you have to stretch out those hip flexors. At the knee, it's very common to have very tight or shortened hamstrings because you don't want to fully straighten that sore knee. It's normal to want to keep it a bit bent. So we do a lot of work to try to get you to stretch out your hamstrings. So what are the recommendations? The recommendations for being physically active after a hip and knee replacement have been put together through surveys. So cross-sectional or snapshot in time, as Allison mentioned, survey of specialists primarily in the United States. So they surveyed groups of orthopedic surgeons who have special interest in hip and knee replacement and asked them to either recommend, strongly recommend with previous experience, not recommend, or come to no conclusion or have no sort of a perspective or prior, no recommendation at this time, similar to what the guidelines are. So it's similar to what you saw people are returning to. These are the current recommendations for being physically active after a hip and knee replacement. And I've only included the ones that were recommended for both hip and knees. There are a few sports that are separate. This is Dawn. She gave me permission to use her image. She has a knee replacement about 8 years ago, and she participated in the BC Senior Games this summer in shot put. Now, shot put didn't even get discussed for some reason. I wouldn't necessarily recommend it, but I thought this was great. With experience, so you have previous experience doing this exercise, you're at less risk for injury or problems with returning to it. And then, of course, common sense says don't do exercise that puts you at risk for injury or high impact. I think in light of the time, I'm going to, maybe someone could ask me about this on the panel. I'm going to tell you a little bit about a study, but I'd like to wrap up with just some take-home messages and tips on being active. This individual here, Ed, he gave me permission as well to use this photo. He's awaiting a knee replacement. That's his 7th joint replacement. And he only put in 2,000 kilometers on his bike this summer in preparation, so he's a little disappointed. But these are some of the ways that you can stay motivated to do exercise after a joint replacement. And I want to stress that it's very important to find an exercise, and Dr. Hunt mentioned this, that one is enjoyable and fun, because you're not going to stick with it if you don't. And also it's really helpful to find a role model or a buddy, someone who you can successfully exercise with. I can't emphasize that enough, and the research supports that. Okay, and those are some resources for you. And if the slides become available, then you'll be able to click on those direct links as well and access those. Thank you.